Hi, welcome to The Pain Show. I'm Dr. Paul Lynch. On today's episode of The Pain Show, we have one of our patients here at Arizona Pain Specialists who's joined us. Ken, thanks a lot for joining us on today's show.
Oh, you're very welcome.
Today we're going to talk to Ken a little bit about his pain, and we're going to talk a little bit about cancer pain. Ken was unfortunately diagnosed with CLL, which is a type of leukemia.
Well, when I was diagnosed, it was kind of a surprise, but I did have a lot of pain. Uric acid in my blood settled into my spine and my shoulders, and it just, I couldn't even get out of a chair or get out of my car. My oncologist referred me to you folks, and I came down here hoping you could help me out, and you certainly did.
Tell us a little bit about the type of pain you had and what it felt like.
Well, it was across my lower back, down my right leg, like a sciatic pain, really very sharp stabbing pain. Also on my shoulders, I couldn't lift my shoulders only about halfway up my body, whereas now I can elevate them above my head, and I no longer have the pain in my hip or my lower back. Well, my chemotherapy experience, when I went in, the first treatment that I had, I was so much in pain that I couldn't even get on the doctor's table. They had to help me. And my first chemotherapy experience, they gave me a shot of Rituxan. And the Rituxan actually eased the pain of where I was hurting in my back and in my shoulders, and I went, oh golly, that feels so good, that I was actually looking forward to my next chemotherapy treatment, if you can believe that or not. So I knew something could be done. It's just finding the right place to go to have it done. On a day-to-day basis, it was the point of excruciating. They asked me pain levels was between 8 and intolerable. And after the folks have given me this treatment, I'd say 97% of my pain is gone. It's just
wow, 97%.
Easy, yeah.
Tell us a little bit about today and what it's like to be almost pain-free.
It's given me my life back. When you have a lot of pain like that, you're moody and angry and everything that goes along with that. You can't exercise to try and get your weight down and the rest of those types of things. Like I said, it's just really given me my life back. I am now feeling that I'm getting the strength back in my legs, and I want to get out there and walk.
A lot of patients that come to us with cancer pain, they feel like pain associated with cancer really has no solutions. Was it surprising to you that the doctors at Arizona Pain Specialists could help pain from cancer?
Yes, it did surprise me. I didn't know that it would help, but believe me, it does.
You know, cancer pain is an area that's actually really close to my heart. When I was in medical school, my mother-in-law was diagnosed with pancreatic cancer. And at that point, I didn't even know pain management was a specialty or that it existed. I saw her suffering through chemo, and she eventually developed fractures in her spine and had a lot of pain in her abdomen. And you know, that experience for me personally is what really drove me to go into pain management. And I really found out that there are treatment options available no matter where you have pain, if it's your joints or if it's your back. And so this is an area that we really focus on at Arizona Pain Specialists. And we're so glad that you personally got relief from the pain you were having.
I'm very glad too.
Ken, we want to thank you for coming on our show today to talk about your experiences. I know they're very personal experiences, and it's exciting for us that we've been able to help you.
Well, I just want to thank you folks. Like I said, I'm getting my life back, and I really appreciate it.
Thanks for joining us for today's episode of The Pain Show, brought to you by PainDoctor.com. Today we talked about cancer pain. If you want more information about cancer pain, please visit us at PainDoctor.com. And remember, at The Pain Show, we believe you can be pain-free.